All right, let's jump right in. Today, we are going to talk about something that's, well, it's absolutely crucial for every single care provider out there. It's called the Point of Care Risk Assessment, or PCRA. And I know, it sounds a little formal, but trust me, this isn't just another procedure. It's a way of thinking that can become your personal safety superpower. Let's break down exactly how.
So let me ask you a question. What's the single most powerful safety tool you carry with you on every single visit? It's not your gloves, it's not your mask, or your hand sanitizer. The answer? It's your brain. It's your professional judgment. It's a mental toolkit that you're using every single moment. And today, we're going to show you how to get it razor sharp.
Okay, so first things first, we've got to talk about the why. Why is this so important? Because unlike a hospital, which is a controlled, predictable space, every single home you walk into is a completely different world. And it's that unpredictability that makes having a standard way of thinking so critical.
And this, right here, this is the reality of the situation. People can be contagious without ever showing a single symptom. You have zero control over how clean a space is or how cluttered it might be. You can't control the airflow or who might decide to pop in for a visit, and that includes pets. That's why you can't just go on autopilot. Every visit needs a fresh look.
So you've got all this chaos, all these unknowns. What do? How do you take back control in a situation that feels uncontrollable? Well, you do it by consistently using one powerful tool, your dedicated infection control tool, the Point of Care Risk Assessment. So what is this thing really? Think of it as a super fast, on-the-spot evaluation. This isn't some form you fill out at the end of the day. No. This is a live, in-the-moment mental check you do before, during, and even after you interact with a client. It's all about figuring out the risk and deciding right then and there what you need to do to keep everyone safe.
I love this quote because it just nails it. You'd never want to get on a plane if you knew the pilot skipped their pre-flight check, right? Of course not. The PCRA is your professional pre-flight check. It's that critical step that puts you in the pilot's seat, making sure the journey ahead is safe for both you and your client.
Okay, so you might be thinking, this sounds like a lot to remember. But honestly, it's not. It really just boils down to a super quick 3-factor scan. You just need to glance at 3 specific areas, and that's it. You'll have the full picture.
All right, number 1, the client. Your eyes go right to the person you're there to help. What are you seeing? Do they have a cough? Do they seem to have a fever? Or maybe they have something like an open wound that could be a risk. This is your first and most important piece of information.
Next up, you think about the task. What exactly are you about to do? Because the risk level for helping someone walk across the room is totally different than the risk for, say, providing wound care or helping with toileting, anything involving bodily fluids. The task dictates the risk.
And the third and final piece of the puzzle, the environment. You got to take a quick look around. Is the place cluttered? Are there trip hazards? Are there pets running around? Is the air stuffy and still? The physical space you're in is that last crucial piece of information you need.
And boom, here it is, all laid out. You quickly scan the client for symptoms, you consider the task you're about to perform, and you take stock of the environment. It's not about looking at these things in isolation. It's the combination of all 3 that gives you that crystal clear, immediate snapshot of the risk you're dealing with in that exact moment. Okay, so you've done your 3-second scan. You've got the lay of the land. Now what? Well, now you act. And there's a really simple 4-step way to think about turning that information into a decision. Think of this as your personal decision-making flowchart. It's so simple. Before you jump in, you just stop, take a breath, then assess those 3 factors we just talked about: client, task, environment. Based on that assessment, you choose your tools for the job. Is it just good hand hygiene? Or do you need gloves, a mask? And then, only when you've done that, do you proceed. And never forget, if something feels wrong or unsafe, you always have the power to pause and get help.
All right, that's the theory, but theory is, well, it's just theory, right? Let's put this thing into practice. Let's see how the PCR works out in the real world with a few common scenarios.
Okay, scenario 1. You walk in, and your job for the next few minutes is to change a dressing on an open wound. Instantly, what's your brain telling you? Using that framework, client, task, environment, what are the big risks that pop into your head?
Right. The big, obvious risk here is contact transmission. Germs. So your response is immediate and logical. You choose gloves to act as a barrier, you double down on hand hygiene before and after, and you make sure anything reusable gets disinfected when you're done. See? Simple, logical, and safe. Okay, let's try another one. This time, the client seems totally fine, and the task is just simple mobility assistance. But you walk in, and the environment is, well, let's just say it's cluttered. A lot of stuff everywhere, pet hair on surfaces. How does your PCRA guide you now?
See, in this case, the risk isn't really coming from the client or the task, it's the environment. It's all about contamination. So your PCRA might tell you to wear gloves, not for the client, but just to handle items and clear a path. And crucially, you take a minute to clean the area you'll be using before and after you provide care. It just shows how flexible this tool is.
All right, last one. And this is a big one. It happens all the time. You're right in the middle of helping with personal care, and your client starts coughing. A lot. The situation has just changed right in front of your eyes. Your PCRA has to update in real time. What do you do?
Your brain should immediately be thinking, droplets, potential respiratory illness. So what's the move? Your assessment tells you to protect your own airway. You choose to put on a mask and maybe even some eye protection, and you make a quick environmental check. Can you open a window to get some air moving? You've just adapted to a changing risk, right on the fly.
So when you boil it all down, what's the one thing you need to remember from all of this? It's this. The point-of-care risk assessment is not another piece of paperwork. It's not a box you tick on a form. It's a habit. It's a mindset of professional awareness that becomes second nature on every single visit.
Okay, I want you to be honest with yourself for a second. Think back over your last few shifts. Can you think of a time when maybe you got partway through a task and had that uh-oh moment, realizing you might have underestimated a risk? It happens to the best of us. The key is to learn from it. So, with all that in mind, what's just one small change you're going to make on your very next shift? Maybe it's just committing to that 2-second pause before you even walk in the door. Or maybe it's paying more attention to the environment. What's your one thing going to be?
And this really is the whole point of our conversation today. This isn't about just following a rule because you have to. This is about empowerment. It's about you taking active, moment-by-moment control of your own safety and the safety of the people you care for. So the only real question left is, how are you going to take this simple framework and turn it into your superpower? Because once you do, you're not only safer, you're a better, more confident care provider.